program, President Rodrigo Duterte orders a thorough probe after expressing his concern over the illegal selling of COVID-19 vaccines. Amid limited vaccine supply, some Metro Manila cities suspend their COVID-19 vaccination programs. How is this affecting the government's population protection goal and messaging? The Health Department urges strict border protocols amid the threat of a so-called lambda COVID-19 variant. Health Secretary Francisco Duque joins us live. Vox confirms that the Taal volcano has recorded a phreatomagmatic eruption. That's a phreatomagmatic eruption this morning. According to its recent bulletin, VVOX says that the eruption reached 300 meters high from its crater. 55 volcanic earthquakes have also been recorded. The volcano also released steam plume in the last 24 hours as high as 2,500 meters. A phreatomagmatic eruption happens when magma and water interact explosively. Alert level 3 is still raised over Taal. Stay tuned to CNN Philippines for more details on this developing story. President Rodrigo Duterte directs authorities to press charges against those selling COVID-19 shots, highlighting that those behind it will be punished. He also reminded everyone that these vaccines are free of charge. The president was responding to the National Bureau of Investigation's apprehension of 3 individuals allegedly selling 3,000 Sinovac vaccines. Here's the president in his own words.
This is very alarming. We condemn these acts and we will not allow perpetrators to go unpunished. Huwag ninyong pilitin ninyo. Alam mo, pag medisina, I'm extra sensitive sa mga ganon. Lalo na you deprive, bilihin ninyo. Ang walang pera, yung mahirap ang maalisan ng whatever the opportunity or for the slots taken away. Huwag ninyong gawin yan kasi nag-warning lang ako. Huwag ninyong gawin. Yan ang droga. Huminto kayo. Sinabi na sa inyo do not wait for the day on its 25th hour, when the hand of the clock shall strike, for the bells to toll, to sound your knell of grief. You're not allowed to buy. The government will take care of that. Kasi kayong mga mahirapan kayo, so do not press your luck too far. You might regret it.
All right, let's go straight to the source of the story. We have Health Secretary Francisco Duque III. Secretary Duque, maraming salamat po sa inyong oras. Welcome back to the source, sir.
Yes, good morning, Pinky, and also to your viewers. Thank you for the invitation in behalf of the Department of Health.
Let's start with the situation in Taal. That's breaking news here on CNN Philippines, sir. So, nagkaroon po ng phreatomagmatic eruption according to VVOX. It reached 300 meters high from its crater and there were 55 volcanic earthquakes also recorded. I know that you were recently in, was it either Agoncillo or Laurel, no? Secretary Duque, nagkaroon po kayo, you monitored the situations there and also did a vaccination drive, a ceremonial vaccination drive also there. What do you see? What should be done right now and what would be your recommendation, sir?
Well, first of all, I was there the other day, July 4, precisely to assess the health condition and the situation of several families in the various evacuation centers in Barangay Puok and Barangay Elena, as well as the simultaneous vaccination activities. No? So far, okay naman. Ang akin lang ibinibigay na paalala sa kanila or abiso, pag-iingatan na yung sulfur dioxide emitted by the volcanic phreatomagmatic eruption can affect the skin, the eyes, the lungs, the throat, and also special care for those with asthma, bronchitis, and emphysema. No? So I also looked at the water and sanitation and hygiene measures that have been put in place jointly by the local government unit of Agoncillo and also the DOH Center for Health Development Calabarzon. So by and large, mukhang okay naman, but they have to really monitor the situation. And if there's a need to bring them farther away from the 7-kilometer radius danger zone, no? So we advise the public there to be vigilant and follow all the warnings of the local government units together with the FIVOLs.
The thing though is, as you mentioned, Secretary Duque, kailangan po nilang pag-ingatan yung sulfur dioxide o yung pong asupre with regards to in relation to their health. And then there's the second part of this, na doon po sa mga evacuation centers, nagkaroon po ng vaccination din dahil nga kailangan yung health protocols, manatili strict adherence to health protocols. And because there's a vaccination drive, the thing though here is, before they are fully protected, it may take possibly another 6 weeks kasi first vaccination, about 28 days later ang Sinovac, and then 2 weeks after pa that, yung pong makukuha nila talaga yung full protection from COVID.
Well, you're right. That's why it is a cause for concern. The difficult physical distancing that can be observed in the tents, for example, that were set up in Barangay Puok. No? I had requested the local government chief executive to look for public elementary school buildings where there will be hopefully better physical distancing observed rather than putting them inside the tents. No? So also there has to be a very strong system for monitoring the symptoms, no? And exposure of people in the evacuation center. And doon, pinuntahan ko nga yung mga tents. No? Tama ka, tabi-tabi, magkakapamilya naman. No?
Opo.
So, ang health officers natin doon, yung municipal health officer, the provincial health officer, are really closely monitoring the health conditions of the evacuees. No? And of course, the health protocols are being observed, but it's a cause for concern. And that's why hopefully they'll be able to identify more school buildings and use them as evacuation centers, because right now these buildings are not being utilized as there are no classes at the moment.
And we're talking about vaccination right now. Patuloy po yung vaccination dyan. In Batangas, well, to the residents around Taal who have been evacuated also. Let's talk about the vaccination here in NCR Plus. LGUs, Secretary Duque, have actually suspended or even limited yung pong kanilang first dose ng vaccination due to supply issues. You have Parañaque, Malabon, Navotas, Muntinlupa, Makati, Caloocan, and Pateros. Even Pasig was saying yesterday, in yesterday's report, that they only have 11,000 vaccines left and they can vaccinate 7,000 a day. So more or less by today siguro, sir, baka ubus na po yun. What is the mandate of government now na hindi pa po talaga dumadating yung mga bakuna for July? Of course, Secretary Galvez had already said that the Sinovac vaccine, which was supposed to arrive every week, ang dating ata baka third week pa of July. What is the mandate now?
Well, the National Vaccine Operation Center has already released the advisory for the LGUs to pursue the second dose vaccination. Because, you know, hindi naman pwede puros first dose lang tayo, as we all know that will not confer complete or satisfactory protection, no? Ample protection. So, umpisahan na yung second dose. Huwag nang nag-aantay na puros first dose. Kasi marami pa naman tayong bakuna, kasama naman yung allocation for the second dose, no? So that's what we have already communicated to the LGUs, and hopefully that they will already implement the second dose inoculation.
That was the mandate given by Secretary Galvez as well. So we're clear on this. Priority and focus should be on those individuals who have received their first vaccine para po matanggap nila yung second vaccine for better protection, sir.
Exactly. Tama po kayo. Kailangan po talaga yung ating bakunahan. Yung pangalawang dose nga, mas importante pa yan. Ano? Dahil yan ang magbibigay ng sapat na proteksyon laban sa severe COVID, laban sa pagpapa-hospital. Ano? It will help prevent hospitalization and deaths. No? So you hardly can get that effect just with the first dose. No? So you need ample protection with the second dose.
So is it safe to say, Secretary Duque, na wala munang halos magaganap na first dose vaccination until dumating po yung mga supply?
Yes, third week, we're expecting about 2.5 to 3 million Sinovac doses. No? By the end of, I think, the month, if I recall, Secretary Galvez said mga 6 million ang makukuha natin Sinovac. So we will be able to restart the first dose inoculation as soon as the supplies begin arriving.
So kailangan po, just to be clear on that, we're going to wait for the supply to arrive para po magpatuloy o maumpisahan rather ang first dose ng vaccination. Secretary Duque, we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Secretary Francisco Duque. Secretary, let me go to the Delta variant, which is said to be more transmissible and supposedly deadlier strain. The thing with the Delta variant is that it actually, well, among others, it targets individuals who are not vaccinated. Are you concerned, sir, that so far we have only vaccinated fully about 3 million individuals, which would account to about 5% of the 70 million, 5% of the 70 million to reach herd immunity? Kayo ho ba kahit papano, is this a cause for concern for you? Nangangamba ho ba kayo?
Again, it is a cause for concern given the low vaccination coverage of about 4%, no? Of herd immunity, full coverage. So having said that, we really have to enforce strict border controls, no? In the seaports, in the airports, and making sure that the travelers who come in are quarantined for 14 days, 10 days in the government assigned quarantine facility, test on the 7th day, and completion of the remaining 4 days in the LGU managed facility or home quarantine. No? So it's been Delta variants doon because of our strict border controls. No? So this has to be consistently enforced.
I know that's exactly what you were telling the president last night, strict border controls. But what I want to find out from you, sir, is that do you see or are you considering possibly adding more countries to the 7 countries already being banned from entering the country due to the Delta variant? Are you considering na kailangan na po itong dagdagan?
Yes, it is already being studied by our vaccine, our technical advisory group of experts. No, And so we await the recommendation. Tomorrow, we will have a meeting. Hopefully, that will be part of the agenda.
Aha. Sir, ano hong nakikita niyong possibly countries na masama dito sa ban? Would Indonesia be one?
Yes, Indonesia and I think also Malaysia, no, because of the proximity of said countries to the southern parts of the Philippines and the porousness of the borders, no. So, in spite of that, the strict border control is what we have to remind our LGUs, our other national government agencies to jointly enforce, no? Because it has been proven time and again that strict border control is crucial to our response. No? In fact, the also reminder for a more disciplined compliance to the minimum public health standards. We keep saying this, and we never tire reminding people to wear the properly face mask, face shield, the washing of their hands, and physical distancing, and avoidance of places with very poor ventilation. So these are some of the measures that we have been reminding the public. No? So it's a joint effort, no, of everyone. It's actually a four-door policy that we have adopted. No? First is we ban travelers from high incidence of variants, no, which we did before initially. With UK, we banned it, and all other countries temporarily, though. And then number two, gate two, that's gate one. Gate two is really strict border control, seaports, airports, etc. And then gate three is really intensifying the implementation of prevention, early detection through aggressive or active case finding, aggressive isolation, testing, and quarantine. And of course, the gate four is when the case is already actually affected the communities, then we make sure that the clinical case management of severe to critical cases of COVID-19 is done very well, so that this will save lives. No?
You mentioned, Secretary, government is considering, the right word right now is still studying or considering banning travelers from Malaysia, travelers from Indonesia. Meron pa po mga bansa. Yes. Meron pa hubang bansang posibleng madagdag dito na pinag-aaralan ngayon?
Well, there's always the possibility. Remember, Pinky, that the Delta variant is already detected in about 85 to 90 countries
98 countries.
No? So we have to look at the we have to look at the trajectory of the cases in those countries, and we should be guided by the metric of gaano ba kataas ang attack rate nila per 100,000 population. No? Ano ba yung itinaas ng kanilang mga kaso in terms of percentage increase over the last 2 weeks. So we are looking at this. No? We are guided by this, and our experts, what countries other than Malaysia and Indonesia will be added to the list of possibly banning travelers from such.
Okay, Sec, very quickly, no, I know this has to be a race against time. Ano po? When do you think a decision has to be made on this, on adding countries that could be banned from travelers entering the Philippines? Kailan po kaya ito?
Tomorrow.
Okay.
Tomorrow, Pinky.
Okay, Secretary Duque, we need to take another short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Secretary Francisco Duque. I want to talk about the no PCR for domestic travel for fully vaccinated individuals, Secretary. There was a concern by Governor Kua regarding this because I do remember he said that hindi man lang daw sila kinonsult regarding this, and that at the end of the day, the implementation of this will fall on the LGU. So, bakit ho kaya SEC hindi nakausap yung mga government officials, local government officials regarding this? Hindi na po kailangan ng PCR for domestic travel.
Alam mo naman, Pinky, itong IATF natin, itong policy na ito, every 2 weeks nire-revisit naman natin. No? So we do not close our doors to the recommendations coming from the local government unit. Like for example, the Union of Local Authorities of the Philippines, where Governor Dax Kua is the chairman. So we will invite him tomorrow in the IETF meeting so that he can personally represent the concern of certain local government units. Hindi naman lahat no? Tayo kasi, ang mga policies natin are always evidence-based, no? And almost always it is science-based, no? Data-driven, science-based. That's why we really depend very largely on our groups or panels of experts, no? So we put premium to the recommendation, and I believe that this resolution was an offshoot of the sound recommendations brought to us by our panel of experts.
How can one actually, so what happens, Secretary, is that if you want to go on a domestic travel and you're fully vaccinated, all you need to do is really present your vaccination card or a certification. I guess the question would be, who validates these vaccination cards or certificates if they are authentic? Because pwede rin po, on a follow-up question on this, kung meron po nagbebenta ng mga vaccination slots, ng mga vaccines, pwede ho kaya kasi papel lang ho yun eh. Baka mangyari din po, SEC, na pati yung vaccination card ay mabenta na rin.
Well, peke, unang-una, that is a clear violation. No? If somebody does that, they face the risk of being prosecuted and penalized to the full force of the law. These are public documents. No? You cannot just fake this and misrepresent so that you can enter a particular LGU. So that's already a warning that I would like to give at this point. But the system for authentication really has to be constantly reinforced, strengthened. No? So right now, the LGU is the one that will certify that a particular vaccinee is a bona fide holder of that card. So inter-LGU arrangement yan. No? But we will ensure that the system is in place. But this is evolving. No? There's no such a thing as a perfect system. Moment you implement this, you implement and make the necessary adjustments as soon as you identify certain gaps. No? But by and large, we can work together to ensure that kasi yun naman vaccinated individuals, it's among domestic travelers. No? Napaka-importante niyan dahil parang in-incentivize mo rin na sila ay makalabas na, makapunta na sa mga ligtas na mga lugar, and at the same time, protektado sila. No? So kung gusto ng mga LGUs na meron pang added layer of protection or like a testing just to ensure that they're not infected, okay naman po yun.
Yeah.
But we will reconsider as soon as we get more data on this. So everything is evolving, Pinky.
Yeah.
So,
Yeah.
ahirap talaga. Hindi pwede magsalita ng tapos.
Yes, I understand that, Secretary. But the thing is, I'd like to give you an example. Let's say someone were to travel domestically, ano po, because this could also serve a problem in the check-in counters or in the airports itself. For example, you want to travel to Bohol, dadalin lang po, kasi sabi vaccination card or certification. Please correct me if I'm wrong. Pero ang alam ko, it's or. So I can bring my vaccine card, ano po, na tapos na supposed to be. One can bring it, 2 dose na po yung individual. Who checks this? Is it going to be checked by the security guard papasok ka ng airport? Is it going to be checked by the personnel in the check-in counter? Who is actually going to check it? And how is that person supposed to know na iiba-iba po kasi yung mga vaccination cards natin? Guess that's a problem or a concern that needs to be addressed.
Yes, you're right. This is a very operational issue. I will take it up with the National Vaccine Operations Center to how they're addressing this. But to my simple mind, somebody has just to check, that 2 weeks after your last jab, you are adequately protected. Kasi hindi naman pwedeng travel ka na immediately after your second dose. No? So you have to wait pa rin.
Yes.
So you look at the date. You have to look at the date. You have to be mindful of the dates. No? And then where the vaccination was given or done, and that there should be a system to validate this either through a number or through a DICT kasi is still coming up with a database of all vaccinated individuals, all 12 million of them. And I understand that as of yesterday, they've already uploaded about 3.5 million unique individuals who have been vaccinated into their database. So that
I see.
At a click, meron na makikita na may record ka kung vaccinated ka ba o hindi. So this
I
is
guess,
also evolving. So
yes.
tapos yung health
That's where I wanted
screening
to go,
pala,
no?
nakalimutan ko completely.
Go ahead, Sec.
Yung health screening, as I have quickly mentioned earlier, this is also very, very important to detect whether may symptoms yung tao and also saan ba sila, yung mga exposure nila, kung meron bang ganon. So part of the interview should touch on these 2 points that I have just raised. No?
Secretary Duque, we've run out of time. Thank you so much and do take care. Maraming salamat po sa inyong oras.
Bilis naman, Pinky. Maraming salamat. I look forward to the next interview. I know you have many more questions to ask. You never run out of them. Thank you.
Maraming salamat, sir. Take care of yourself. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.